Foley Catheter. A Foley catheter is a thin, flexible tube that drains urine from the bladder into a collection bag outside the body. It is also known as the indwelling urinary catheter. Eyelet that drains urine. A catheter's eyelets, also known as drainage eyes or drain holes, are small holes or openings located on or near the tip of a catheter. Their purpose is to allow urine to flow into the catheter tube and drain out when the catheter is inserted into the bladder through the urethra or stoma. Most catheters have at least 2 eyelets, but some may have 1 or more than 2. Some catheters have staggered eyelets to help maintain tip strength and promote efficient drainage. Some catheters are made of PVC to eliminate latex allergy concerns. Some catheters have advanced eyelet to enhance patient comfort during insertion and removal. Balloon. Uninflated, inflated. The balloon of the catheter usually sits at the base of the bladder, obstructing the internal urethral orifice. A fully inflated balloon allows the catheter tip to be located symmetrically. Catheter. A catheter is a tube that is inserted into your bladder, allowing your urine to drain freely. Catheter connected to the drainage tube. Port for the balloon. The inflation and deflation port for a catheter is typically located at the distal end of the catheter, next to an elbow with a luer lock cap. The luer lock cap allows the user to inflate or deflate the balloon once the catheter is in place. Balloon size. The most common balloon size is 5 ml, but 30 ml balloons are also available. Balloon inflation. The balloon is usually inflated with sterile water, but saline is not recommended because it can crystallize and prevent the balloon from deflating. Balloon purpose. The balloon keeps the catheter in place inside the bladder. Drainage tube. The drainage tube of a catheter is a flexible tube that drains fluid from the body into a bag or container. Collection bag. A catheter collection bag is a bag that collects urine that drains from a catheter that's inserted into the bladder. There are several types of catheter collection bags, including leg bags and bedside bags, and they can be used for different purposes. This is a leg bag, and this is a bedside bag. Emptying spout. The emptying spout of a catheter is the tap or valve at the bottom of a catheter bag or the end of a catheter that allows urine to drain. How to insert a Foley catheter. Get all the equipment ready. Choose the right size catheter. Using the wrong length catheter can cause severe pain and serious complications, such as penile swelling and renal failure. How do you know which size to use? The size of the catheter you should use depends on several factors, including your anatomy, preferences, and type of urine you're draining. A general rule of thumb is to use the smallest catheter that still allows adequate drainage. Catheter measurements are either used with CH or FR. 338 urethral catheters are measured in chiares. The chiare is the outer circumference of the catheter in millimeters and is equivalent to 3 times the diameter. Thus, the 12CH catheter has a diameter of 4 mm. FR stands for French, which is a unit used to measure the outer diameter of the urinary catheters. 1 French unit is equal to 0.33 millimeters or 1/77 inch in diameter. The average size of catheter for adult men is 14 to 16 French in size, with 14 FR being the most common. The average size catheter for adult women is 10 to 12 French, with most women using 12 French catheters. The appropriate size of catheter for a female baby depends on the child's age and size of their urethra. Newborns 4 to 6, infants 6 to 8, prepubertal girls 10 to 12, adolescents up to 14 FR. The size of catheter for a baby male depends on the baby's age and weight and can range from 5 to 8 French. Neonate to 6 months 5 to 6, infant or toddler 6 to 8, 14 French catheters often used for adolescents. Color on the end of the catheter determines size. Inserting Foley catheter into male. Put on gloves. Clean the genital area. Use an antiseptic to prevent infection. Apply numbing gel and lubricant. Minimize discomfort. Insert the catheter. Gently insert the catheter into the urethral opening. Inflate the balloon. Once urine is visible in tubing, inflate the balloon at the tip with sterile water. Secure the catheter. Use a stat lock or adjustable strap to secure the catheter to the patient's leg. Inserting Foley catheter into female, put on gloves. Patient positioning. Ensure patient privacy and position them in a supine position with their legs slightly spread apart. Sterile field preparation. Set up a sterile field with all the necessary supplies, including sterile gloves, drapes, antiseptic solution, and the catheter itself. Labia separation. Use the non-dominant hand to gently spread the labia and expose the urethral opening. Cleaning the area. Cleanse the urethral meatus with an antiseptic solution using sterile swabs moving from the vulva towards the anus. Catheter insertion. Gently insert the lubricated catheter tip into the urethral opening. Urine flow confirmation. Advance the catheter until urine begins to flow, then insert a little further. Inflate the balloon. Once urine is flowing, advance the catheter slightly further and inflate the balloon with sterile water at the recommended volume. Secure the catheter. Attach the drainage bag to the catheter, ensuring it is positioned below the level of the bladder. How do you know how much to inflate the balloon? Completely inflate 5 cc balloon with the volume prescribed in the package using the entire 10 cc of sterile water provided. The package will tell you how much to use. How to remove a Foley catheter. Empty the urine bag if needed. Wash your hands. Locate the balloon port, which is marked with colored valve and number. Cut the valve off the balloon port just behind the valve. Wait for all the water to drain out of the balloon. Gently pull the catheter out. Throw away the catheter bag and absorbent pad. Clean the area around the genitals. I hope this video helped you. Subscribe for more. It is free. Thank you.